Mr. Henry Chow of CMS, when he was here several weeks ago in response to a question, Congressman Gardner of Colorado made a statement that 40% of the computing system hadn't even been built yet. That all what he called the back end hadn't been built, which I'd assume would be the accounts payable and accounts receivable and income verification and things like that. Could you tell us what's being done to try to get that ready by January the 1st, since almost half the system, according to Mr. Chow, hadn't even been built yet?
Congressman, I'm not exactly sure what Mr. Chow was referring to, but I can certainly tell you where we are in the build. I think the emphasis was getting the consumer-facing portion ready for October 1st. As you know, that didn't go so well. The financial management system, which is getting the insurance companies their money for accelerated tax credits and for cost sharing, is due to go into effect in mid-January. There are also some other pieces of the puzzle, not income verification. That's done as part of the application at the very front end in order to qualify someone. So that's all built.
Well, do you agree with Mr. Chow that a large part of the system hasn't been put together yet? And if so, aren't you concerned about that?
Well, it's in the process currently of being put together. The income issues, again, I want to clarify for the committee that because it's been a bit of a misunderstanding, accelerated tax credits and cost sharing don't go to consumers, they go to companies.
You're
dealing
missing
with 200 to 300 companies, and we have a system that we've announced working with companies where they will be paid in a timely fashion.
Well, I don't want to beat a dead horse, but we all agree that the website to try to enroll people has not worked very well, to be as polite as possible. Now, that's the easy part. So now we're down to, in January, there are lots of people that think they're going to have insurance that don't have it now. And the part of the system that when they go to the doctor or to the hospital, and they give them their new insurance card, that they check to see if they're covered and what the coverage is, that's not there. And there's no system there to pay people. There's no system there to determine whether this doctor or this hospital is eligible. And you still want to get this thing started on January the 1st?
Congressman, I think that is not an accurate statement. We certainly have a plan, and we have vetted it and discussed it with insurers that they are very comfortable with to get them their reimbursement.
They were also very comfortable that October the 1st was going to work. And
sir, this is people will be enrolled. That system is in place. That's what the application is about.
I predict we'll have you back here in mid-January or February talking about this problem.
This is reimbursing insurance companies. At the end of the day, it has nothing to do with enrollment. Enrollment will.
It does have anything to do with enrollment. Let me go to my second.
When people go to the doctor and go to the hospital, they will have a card. They will be.
I've got a minute left. I've got one more question. I want to put the slide up that says on Section 1401. Under the law, Section 1401 says that if you go through a state exchange to get insurance under what we call ObamaCare, that you're eligible for a subsidy. If you don't go through that state exchange, you're not eligible for a subsidy. Now, IRS has ruled that we don't have to obey the law. We're going to give the subsidies whether we go through the state exchanges or not. What's HHS position on obeying the law and doing what the law says, which would mean almost everybody who signs up for Obamacare is not eligible for a subsidy because they're not going through the state exchanges?
Sir, we have deferred to our partners at the Justice Department and at the Treasury for.
Now, what's your position? What's the HHS position?
We have deferred to our partners. This is in litigation, as you know, right now. We feel that the
I'm asking what your position is. You're not worried about obeying the law.
We feel that the law covers both state and federal exchanges.
That's not what it says,
recommendation of the
Madam
Justice
Secretary.
Department.
And
Chair
you know
thanks
it.
the gentleman